directly on Wednesday. I told him, as always, the federal testing and the role that could play in keeping these numbers down. We also, of course, let him know that federal help is available wherever needed, including and especially for long-term care homes. The outbreaks happening in long-term care homes in Ontario and across the country are not only incredibly concerning, they're also tragic. Our parents and grandparents built this country. They raised us, and they deserve so much better. And it is vital that we continue to get vaccines to vulnerable people as quickly as we can. And that's exactly what we're focused on. But remember, no one is invincible. Even if you're young and healthy, this virus can be dangerous. That's why we all have to keep doing our part. We're also constantly monitoring variants of COVID-19 with governments across the country, including the concerning Brazil variant. We're doing whatever it takes to protect Canadians, including looking at banning certain flights if necessary. Decisions must be based on public health guidance, and as always, our ministers are actively leaning in on this and talking to experts to reach a determination without delay. We will continue to keep Canadians informed of any new decisions we take. To people in Ontario now under the stay-at-home order, I know this isn't how you wanted to start the new year. It probably feels like déjà vu all over again from 2020. This won't last forever. But for now, we have to buckle down. This is our best way through in the coming weeks of winter. We've seen the kind of impossible choices hospitals in other countries had to face when they become overwhelmed. Deciding who gets an ICU bed and who doesn't, well, that's not where we want to be. So please, keep following public health guidelines and stay safe. Au Québec aussi, c'est important que les gens continuent de respecter les directives de santé publique pour diminuer le nombre de cas et faire baisser les taux d'hospitalisation. Comme vous le savez, la pandémie a des impacts bien au-delà de juste ceux qui testent positifs. Quand la COVID-19 met trop de pression sur les hôpitaux, c'est tout le système qui en écope. On apprend tous un nouveau mot, délestage. Des milliers de chirurgies sont en train d'être retardées. Le dépistage de certains cancers est plus lent, ce qui met d'autres vies en danger. Les travailleurs de la santé sont épuisés, en plus de devoir prendre des décisions extrêmement difficiles. Je sais que c'est difficile et que les mesures sont strictes, mais pendant qu'on continue de vacciner les gens vulnérables, il faut absolument casser cette deuxième vague. Depuis le début, notre réponse à la pandémie est basée sur la science et sur les meilleures données possibles. Mais mercredi, pendant la retraite virtuelle du Conseil des ministres, différents experts sont venus faire le point avec nous, dont la Dr Tam, la Dr Niemer, le président de l'Agence de la santé publique du Canada et les deux coprésidents du groupe de travail national sur les vaccins. Ce matin, le premier rapport du comité consultatif d'experts sur les tests et le dépistage a été publié. J'aimerais d'abord remercier les deux coprésidents, Sue Pêche et le Dr Irfan Dalla, ainsi que tous les autres membres du comité. Depuis l'automne, on a distribué plus de 14 millions de tests rapides aux provinces et aux territoires. Le rapport du comité ce matin fait des recommandations pour que ces tests soient utilisés de manière optimale et efficace. Le dépistage dans les lieux à haut risque, comme les centres de soins de longue durée, les écoles et les différents milieux de travail, est crucial dans notre combat contre la COVID-19. The Testing and Screening Expert Advisory Panel published their first report this morning. In it, they laid out evidence-informed advice on science and policy for COVID-19 testing and screening. The panel has identified 4 priority areas of action to reduce the spread of the virus, protect Canada's most vulnerable, and limit the impact of the disease on the healthcare system and on the economy. So far, we've sent more than 14 million rapid tests to the provinces and territories, with more on the way. Effective testing and screening is key to stopping COVID-19 transmission and limiting outbreaks in long-term care settings, schools, workplaces, and other high-risk locales. We all have to work together to use these rapid tests to slow the spread of the virus. Today, I also want to talk about where we are with vaccines. On Tuesday, I announced that we reached an agreement with Pfizer to buy an additional 20 million doses of their vaccine. Yesterday, Major General Fortin confirmed that as of today, almost 1 million vaccine doses have been delivered to the provinces and territories. We're working day in and day out to get vaccines delivered as quickly as possible. Shipments have largely been ahead of schedule so far, but with an undertaking this historic, it's only to be expected that there will be a few bumps along the way. Earlier this morning, Minister Anand talked about her conversation with Pfizer Canada regarding impacts to vaccine production. Due to work to expand one of the company's manufacturing facilities, deliveries to all countries receiving Pfizer doses made at the European facility will be temporarily reduced, and this includes Canada. I want to be very clear, this does not impact our goal to have enough vaccines available by September for every Canadian who wants one. It will also not change our second quarter goals. Canada must still get ready for the ramp-up phase in Q2. This kind of issue is out of our hands, and that's why we pursued an aggressive procurement strategy in the first place. Canada has one of the most diverse vaccine portfolios in the world, and we secured the largest number of doses per capita of any country. We have 7 bilateral agreements to ensure flexibility when it comes to supply chains, and like I said, this situation with Pfizer is temporary. Cette semaine seulement, on a livré 380 000 doses de vaccins aux provinces et aux territoires, et les livraisons se poursuivent. On fait tout ce qu'on peut pour livrer le plus de doses de vaccins possible, le plus rapidement possible. Et à travers ce processus, c'est normal qu'il y ait des imprévus. Ce matin, la ministre Anand a expliqué qu'il y aurait un délai de livraison du vaccin de Pfizer qui aura un impact sur tous les pays qui reçoivent des doses de leur usine de fabrication en Europe, incluant le Canada. Je veux être très clair. Cette nouvelle n'a pas d'impact sur notre but de vacciner tous les Canadiens qui le désirent d'ici septembre prochain. Notre phase accélération du deuxième trimestre ne sera pas affectée non plus. C'est une situation hors de notre contrôle, mais on se souvient que c'est pour ça que le Canada est devenu le pays qui a le plus de doses réservées par personne au monde. Et nos ententes avec 7 fabricants et développeurs de vaccins font en sorte qu'on a une marge de manœuvre quant aux chaînes d'approvisionnement. Et d'ici septembre, vous allez tous pouvoir recevoir votre vaccin. I know it's been a tough 11 months, but no matter how much longer this crisis lasts, no matter where you live, we've got your back. Yesterday, a request for additional support was approved by the federal government for Nain in Newfoundland and Labrador. The Canadian Rangers will help with the vaccination effort, as many vulnerable and elderly people in the community need help getting to and from the vaccination site. In Ontario, we approved an extension for the Canadian Red Cross until March 31st to continue supporting isolation and recovery centres for temporary foreign workers in the Windsor-Essex region. And in Manitoba, an extension has also been approved so that the Canadian Red Cross can provide general support as well as support to personal care homes until March 31st. Far too many families are facing the heartbreaking realities of what's happening in care homes across the country. This is a crisis we all need to work together on. And as we have from the very beginning, the federal government will always be there when it's needed most. Before I wrap it up for today, I also want to take a minute to talk about housing. With rising homelessness and housing needs, the COVID-19 crisis has made it clear that affordable housing will be key to Canada's recovery. Everyone deserves a safe and affordable place to call home. In September, we announced an investment of $1 billion through the Rapid Housing Initiative. Today, we can announce the details of the over $203 million that was allocated for Toronto. the city will be starting 7 projects to create more than 500 new affordable homes. These will be prioritized for people experiencing homelessness. Of the total number of new homes, 20% will also be prioritized for Indigenous communities and 20% for women and girls. That takes us to nearly half of the new units that will go to people who are especially vulnerable when it comes to housing. Plus tôt cette semaine, le ministre Hussen a aussi annoncé un investissement fédéral supplémentaire de près de 40 millions de dollars pour accroître et étendre les mesures d'urgence afin d'aider les personnes en situation d'itinérance au Québec. Ce financement additionnel provient des fonds que nous avons annoncés en septembre dans le cadre du programme Vers un chez-soi. La COVID-19 a de graves répercussions sur les personnes en situation d'itinérance qui doivent faire face au froid et à toutes sortes de difficultés. Chaque Canadien mérite un chez-soi sûr et abordable et on va continuer de travailler ensemble pour bâtir un Canada inclusif qui ne laisse personne pour compte. Comme toujours, ensemble, on va bâtir un monde meilleur. Merci beaucoup.
Thank you, Prime Minister. We'll now go to the phones for media. One question, one follow-up. Over to you, operator.
Thank you, merci. La première question, the first question is from David Youngren, Reuters. Please go ahead. Your line is open.
Yes, good morning, Prime Minister. Is your government going to get involved in the bid by the Canadian firm Couche-Tard for France's Carrefour?
Our role as a government is always to be there to support Canadian companies, including as they look to expand around the world. I know that discussions continue to be ongoing, and I won't make any further comments on that.
Follow-up, David?
Okay, because my next question was, do you think the deal is dead, given the resistance in France?
I had a conversation earlier this week with President Macron in which we talked about the need to work together on a broad range of things, from COVID-19 to economic opportunities for our citizens as we engage cooperatively in a global world. I continue to be confident about the ability of Canadian companies to succeed everywhere around the world, and we'll continue to work to ensure that that happens.
Thank you. Next question, operator.
Merci, thank you. The next question is from Lucas Mayer, News Talk 1010. Please go ahead.
Thank you very much. Good morning, Prime Minister. Prime Minister, you just kind of gave the green light, if you will, on Ontario's stay-at-home order, saying it's the type of tough measure that's in place. But I'm curious that with Ontario doing what it's doing, Quebec going with the curfew, and kind of different measures around the province, with the surge in the numbers that we just saw this morning, are you considering at all some sort of short-term, more national approach or implementation, a national form of restrictions and lockdowns? Or are you very confident the provinces should just be in complete control themselves?
As we've seen from the beginning, the course of this virus is very different from one region to another. What is right for Nunavut may not be right for Prince Edward Island, may not be right for British Columbia. And that's why our role as a federal government is to be there to support the provinces and territories through the very difficult decisions they need to take. That's been why we've been there to have Canadians' backs on supports for small businesses, on supports for families, for seniors, for students. We're going to continue to be there to support the provinces and make those incredibly difficult decisions around restrictions slightly easier by ensuring that everyone knows we have their backs. But again, because this is such a disease and a virus spread with different faces and different stories in different parts of the country, we know that provinces are best suited to determine what is the right path for them. Okay. Depuis les débuts, nous avons été là en tant que gouvernement fédéral pour appuyer les provinces dans les décisions difficiles qu'ils ont eu à prendre. On sait que ce virus a différentes caractéristiques ou différents résultats partout au pays dans la façon qu'il se répand. Et donc, chaque province est mieux située pour prendre les bonnes décisions à l'intérieur de leur juridiction. Mais pour aider les provinces à prendre ces décisions difficiles. C'est pour ça que le gouvernement fédéral a fait la promesse d'être là pour appuyer tous les Canadiens. Et nous allons continuer de l'être, avec de l'aide aux familles, avec de l'aide aux travailleurs et aux petites entreprises, avec de l'aide aux aînés et aux étudiants. Nous allons continuer d'être là pour aider les Canadiens et permettre aux provinces de prendre les décisions nécessaires.
A follow-up, Lucas?
Yes, thank you. Prime Minister, on that, do you have any, for Ontario and Quebec specifically, because they're right next door to each other and they have these, one has the curfew, one has the stay-at-home order. Are you concerned at all about just citizens, looking across the border and seeing all of these different rules and any potential confusion, any frustration that Canadians might have for those two provinces specifically?
I think over the past 11 months, Canadians have grown used to looking at what their local public health office official recommendations are about understanding that the course of the virus is different in different parts of the country and indeed in different parts of the world. We have learned lessons about what works here, what doesn't work there, and the public health officials in every region are making the best possible decisions they can that are suitable to their citizens. So yes, of course, we're going to look at what other people are doing, but it's really important that everyone follow the local public health recommendations.
Merci. Prochaine question. Operator?
Thank you, merci. La question suivante est de Boris Proulx. Le Devoir. La parole est à vous.
Bonjour, Monsieur le Premier ministre. Ma question est concernant les voyageurs à l'international. Vous découragez, bien sûr, les voyages non essentiels, mais pour décourager de façon concrète les voyages, est-ce que le gouvernement pense à des solutions qui ont été imposées dans d'autres pays? Je pense à la Nouvelle-Zélande ou en Australie, où il y a des quarantaines obligatoires surveillées par les autorités dans des lieux désignés.
On a, depuis le mois de mars, des mesures extrêmement fortes en termes de quarantaine, avec des pénalités extrêmement sévères et un suivi rapproché au niveau de gens qui sont forcés de qui doivent faire la quarantaine. Évidemment, notre recommandation demeure de ne pas voyager. C'est la meilleure façon de se protéger, c'est la meilleure façon de protéger notre système de santé, nos travailleurs de première ligne et nos aînés. Les gens ne devraient pas être en train de voyager. Mais en plus les mesures de quarantaine qu'on est en train de renforcer, on a aussi amené des règles au niveau du dépistage avant de revenir au Canada, comme d'autres mesures pour nous protéger. Et on va continuer de regarder tout ce qu'on peut faire et pour décourager le voyagement et aussi pour s'assurer que les mesures qui sont en place sont les bonnes pour protéger les citoyens. I think from the very beginning, we brought in extremely strong measures on a 2-week quarantine that is stronger than most of our allies and has been extraordinarily effective over the past many months at keeping Canadians safe from international spread of the virus. But of course, we need to continue to strengthen those measures. We strengthened the quarantine penalties and fines and the follow-ups to make sure that people are actually quarantining. We've also brought in new measures around pre-boarding testing before people return to Canada as an extra measure of safety. And of course, at the same time, we continue to tell people not to travel. We are actively discouraging any form of international travel. That is the best way we're going to make sure we're keeping Canadians safe, not just from the virus, but from all the new variants we're beginning to see elsewhere around the world that we need to keep Canadians safe from. We're going to continue to work to make sure we're keeping Canadians safe with whatever measures necessary.
Merci. En guise de suivi, on a entendu tout à l'heure vos experts de la santé publique demander ou encourager en tout cas des mesures de santé publique très robustes pour combattre évidemment la hausse des nouveaux cas. Je voulais vous demander si dans vos rencontres avec vos experts dont vous avez fait mention tout à l'heure, si certains experts ont exprimé des préférences pour l'approche de l'Ontario ou l'approche du Québec à l'égard de l'ordre de rester à la maison ou du couvre-feu.
La Dr Tam et le Dr New continuent de souligner que l'important, c'est de réduire les contacts que chacun est en train de vivre, de rester à la maison, d'avoir un couvre-feu, de limiter les déplacements, d'éviter les rassemblements. C'est tous des moyens de réussir à réduire nos contacts, mais chaque personne devrait réfléchir eux-mêmes à qu'est-ce qu'ils peuvent faire pour réduire les contacts au maximum. Évidemment, il faut suivre les recommandations locales de la santé publique. Je pense que ce but de réduire les contacts, c'est partagé par les gouvernements à travers le pays.
Good morning, Prime Minister. Glenn McGregor, CTV News. Last time we were here, you said Canada in Q2 would receive enough doses to vaccinate 20 million people. Later that day, the procurement minister said Canada would receive 20 million doses. You know, those are not the same things. Did you misspeak then? And if not, are you still expecting to be able to vaccinate that many people and receive that many doses in Q2, given what we're hearing about Pfizer today?
We've seen the challenges that Pfizer's facing, and it's important that Canadians be informed of these challenges as they come up. But as we've said, it looks like it's only a delay. But of course, this is part of the reason why Canada reached out to so many different potential vaccine manufacturers and secured a broad array of suppliers for vaccines and secured more doses per person than just about any other country. This is a challenge, but we knew these types of challenges would happen with a global effort like this, and that's why we've made sure to ensure that we have a varied approach because, as always, diversity is a good rule of thumb to follow. We know that we're looking to receive more doses from different companies as they get approved as well. This is all part of how we're going to ensure that all Canadians get vaccinated by September. Je pense que c'est extrêmement important de souligner et que les Canadiens sachent que oui, on est en train de faire face à des défis au niveau de la production et distribution à travers le monde. Mais on pouvait s'y attendre. C'est une nouvelle production massive de vaccins et c'est normal que certaines compagnies font face à certains défis. C'est pour ça qu'on s'est assuré de signer des ententes avec beaucoup de différentes compagnies potentielles de producteurs de vaccins et qu'on a sécurisé un accès à plus de doses potentielles par personne que n'importe quel autre pays. Nous allons continuer de faire tout ce qu'on peut pour accélérer la livraison de vaccins et je peux rassurer les Canadiens qu'on garde encore notre cible d'avoir vacciné tout le monde qu'ils voulaient avant la fin septembre 2021.
Stephanie Levitz, the Canadian Press. I wonder if you could explain to Canadians this. If there's too many kids on an outdoor rink, bylaw can issue them fines. If somebody gets in a car and drives to the land border because they want to go shopping at an outlet mall, they get turned back. But if you want to jump on a plane and go to an all-inclusive in Jamaica, go right ahead. Explain that to Canadians. Why is that still okay?
Obviously, there are rules in different parts of the country that apply differently, and different jurisdictions will set up the rules that they think are best based on the best advice of their public health officials. On the federal side, we have strongly discouraged non-essential international travel, including by imposing mandatory quarantines for anyone returning to Canada and now mandatory testing for anyone before they get on a plane to come back to Canada. These are measures that are limiting, as we're seeing the airlines reduce their flights because people are understanding that they are not supposed to travel right now. On top of that, with the concerns people are seeing around different variants popping up around the world, there is even more importance in keeping Canada safe from the arrival of new strains of this virus. That's why we're going to continue to ensure that these measures at the border and on flights are stringent and applied and continue to discourage people from traveling.
Hi, Prime Minister. Tom Perry, CBC. You talked in your remarks about possibly banning certain flights. I'm wondering if you can offer any more detail on that. Is it be to places where there's new strains, where there's been outbreaks? And would you be open to the idea of a ban on travel, or would that withstand a charter challenge?
As we said from the very beginning, we will do whatever it takes to keep Canadians safe based on the best advice and the best recommendations of experts, as we did when there was concern over the Christmas holidays around the UK variant. We banned flights outright coming from the UK while we could bring in stronger measures around pre-boarding testing. Mandatory for anyone returning to this country. We will continue to look at various variants, various geographies, and make sure we're taking the right decisions and the right measures to keep Canadians safe. Every step of the way, we're going to be informed by the recommendations of our experts and of public health doctors on how to ensure we're keeping Canadians as safe as we possibly can.
Total ban, though? Would you look at something like that?
We're always looking at various measures as they are effective elsewhere in the world. But so far the measures that we have taken in place, the extremely strong mandatory quarantine that's been in place since March and has been extraordinarily effective, even as we've seen cases rise from external transition throughout Europe and elsewhere. Our measures have been very strong, but we're always open to strengthening them as necessary. Nous avons des mesures extrêmement fortes pour protéger les Canadiens. Depuis les débuts, cette quarantaine obligatoire a été extrêmement efficace pour empêcher l'arrivée de virus outre-mer. Mais nous allons toujours continuer de regarder qu'est-ce qu'on peut faire d'autre qui serait efficace et correct pour protéger les Canadiens.
Bonjour, M. Trudeau, Laurence Martin, Radio-Canada. Si on regarde les projections aujourd'hui, c'est quand même inquiétant ce qu'on voit. Est-ce que ce n'est pas le temps d'envisager de nouvelles mesures, en plus du couvre-feu comme on a au Québec, en plus du stay-at-home order comme on voit en Ontario? Est-ce qu'il faut aller encore plus loin? Puis je vous pose la question parce que la Colombie-Britannique, par exemple, parle d'avoir une bulle, comme on a vu en Atlantique. Est-ce que vous pensez que ce genre de mesure, c'est une bonne idée?
Je pense que chaque province et territoire doit prendre les mesures appropriées pour eux. C'est certain que nous allons être là pour les appuyer. On a vu la bulle de l'Atlantique. Ils n'ont pas eu la permission, n'ont pas eu besoin de la permission du gouvernement fédéral pour aller de l'avant avec cette bulle d'Atlantique, ni les territoires qui ont créé une bulle depuis les tout débuts. Je pense que chaque juridiction à travers le pays doit prendre ses propres décisions. Et comme j'ai dit depuis le début, le gouvernement fédéral va être là pour aider les provinces, va être là pour aider les citoyens à travers le pays avec des appuis pour remplacer leurs revenus perdus, pour appuyer les petites entreprises, pour s'assurer qu'une fois qu'on passe à travers cette pandémie, on puisse revenir le plus rapidement possible à une économie prospère et une vie plus normale.
Puis une autre question sur un autre sujet, sur les commentaires en fait d'Yves-François Blanchet, le chef du Bloc québécois, sur le nouveau ministre des Transports. Il a écrit hier dans une déclaration, M. Blanchet, « J'ai soulevé des questions légitimes en démocratie. Non seulement le Parti libéral refuse-t-il que le ministre réponde aux questions, mais il tente de censurer le simple fait de les poser. » Qu'est-ce que vous répondez à M. Blanchet?
J'ai été tellement étonné de voir les propos inacceptable de M. Blanchet, surtout après la semaine qu'on vient de vivre aux États-Unis, où on voit à quel point des insinuations, des faits qu'on s'aligne à notre façon, la mésinformation et cet encouragement de l'intolérance et de la haine par des propos tout à fait innocents qui veulent rien dire, mais voyons. Cette intolérance cachée, cet encouragement de se soupçonner n'a pas sa place au Canada et c'est pas digne d'un chef de parti fédéral. I was absolutely floored to see a federal party leader use insinuations and carefully coded questions, particularly this week when we just lived through last week, what happens when leaders don't take care of the words they do and play these dangerous games around intolerance and hate. And of course, stand there innocently and say, oh, I was just asking questions. That's ridiculous. That kind of political pandering to the worst elements and to fears and anxieties has no place in Canada, and all of us need to stand up strongly to push back against that anywhere it happens in this country.
I could just ask a quick follow-up on the border for a bit more clarity. Why is the land border so tightly restricted, but airspace, for lack of a better word, is not? Why can people still get on airplanes and fly in and out of this country, but they can't drive?
Arrival in a different country is managed by that other country. For example, Canadians can't drive into the United States and Americans can't drive into Canada. That Americans not driving into Canada or flying into Canada is a decision that the Canadian government took. The American government took a position on land borders that they haven't taken in terms of air travel. That is their decision. Our decision as Canadians is to make sure that we are consistent and strong in our regulations on travel. Merci tout le monde.